Hi everyone, sorry it's been a little while, but I'm super excited to be back. Today I'll be sharing my experience with obstetrics and gynecology rotation. This was an 8-week in-hospital rotation focusing on women's and babies' health. Because this was my first rotation ever, there was a lot to learn, including how to even navigate the hospital. In my first few days, I ended up getting lost a lot and wandering hallways quite a bit. But eventually I got oriented. In the first couple of weeks, we received lectures and tutorials going over practical skills needed in O&G. For example, we learned how to scrub in properly for surgeries, as O&G involves a lot of surgeries and procedures. We also got to learn other practical skills, such as suturing and tying different types of knots, as you can see me attempting to do here, and the concepts of epidurals, which we got to practice on lemons. During the rest of my rotation, my typical day involves 6 to 8 hours in hospital with a lot of time in theaters and with some tutorials interspersed throughout the day. Afterwards, I would come home and walk my dog in the local park and then study at home or the library to prep for the next day. After a long week of in-hospital learning and studying, I'd meet up with friends on the weekend to unwind and de-stress a little. And during my O&G block, it was actually my dog's first birthday, so we ended up throwing him a little birthday party with his closest puppy friends, and even got him a little dog-friendly cake. Hi everyone! So yes, that was a visual summary of my OBGYN rotation, which I really loved. But now I will go over in more detail about what that 8-week rotation entailed. So as I've mentioned, it was in total an 8-week rotation, and each week had a specific aspect or subspecialty that it focused on. So that at the end of the 8 weeks, I could have a more holistic understanding of what obstetrics and gynecology can offer as a career. So my first week was simply an introductory orientation week that involved mostly lectures from about 8 a.m. to 4 p.m. Monday to Friday. These lectures went over a wide variety of topics such as common gynecological issues and cancers, urogynecology, so like bladder incontinence. They went over obstetrics and delivery, fetal development, and neonatal medicine. However, because there were so many lectures all in one week, they did try to break it up with some in-person and engaging workshops. So some of these workshops included things such as learning how to scrub and gown properly for surgery, how to do basic suturing, and learning the basics of epidurals. Now, please note, we never, performed epidurals on any women as medical students, but we did have the opportunity to practice doing epidurals on lemons so that we can have a basic understanding of what the anesthesiologist is doing when we call for them for a delivery of a baby. And honestly, it was really cool because it's one thing to learn about epidurals and it's another thing to try it out yourself on these lemons. And so you really get an understanding of that. And for those of you that may not know, epidurals is a very common procedure that is requested by women who have pain during labor. So what epidurals do is they introduce analgesia or painkillers to the epidural space, which is found in your spine. And so this allows for the women to not be able to really feel much pain from top of the abdomen to your feet. So that can really help with pain during contractions and labor. So during my second week is when I actually got to go in hospital and start learning through experience. So for my second week, I was assigned to Gynecology Oncology, which is a subspecialty that specializes in looking at cancers of the female reproductive tract, such as ovarian or cervical cancer. Some of the things that I got to practice were taking patient histories and examinations, including speculum examinations. So speculum is a device that is used to visualize a woman's vagina and cervix. So obviously this is a very sensitive procedure, but it is an essential procedure to adequately look at a woman's pelvis and potential issues there, such as cancer. So I was very, very grateful to have the opportunity to have supervised experience in using the speculum. Now, gynecology oncology also involves a lot of surgeries. So I got a lot of experience in the operating room, which I had never been in before. So to me, this was all brand new. And yeah, I just really got to learn about the importance of properly scrubbing in and gowning and maintaining a sterile field at all points. But yes, overall, it was an awesome experience to be in the operating theater, and I even got to assist with some basic procedures. Although I will say that most of the time I was only able to learn by watching, but even then, it was really, really cool. For my 3rd week, I was placed in the Neonatal Intensive Care Unit. Now, NICU is a unit in which preterm babies or very sick babies are sent to, so I felt very privileged and grateful to even be there. Neonatal medicine is very challenging because it requires a lot of in-depth knowledge about all organ systems, so yeah, it was a lot. However, the NICU staff was super lovely and caring, so it made the learning process a whole lot easier. Some of the really interesting things that we got to learn was how to do a neonatal assessment on actual newborn babies, so that was really awesome and cute. As well, we got to learn how to do neonatal resuscitation. And of course, that's very scary, so we only got to do that on mannequins, but even then, it was very challenging because it would simulate an emergency situation in which a baby wasn't breathing and you had to act fast and respond as quickly as possible. So that was a really unique learning experience. For my 4th and 5th week, I was placed in a different hospital altogether. And in the hospital, I was to complete 1 week in obstetrics and another week in gynecology. Now, this hospital was pretty far away, but thankfully I was able to carpool with some friends to get there. However, we did run into some car issues. So, story of the day, we were done clinic finally at around 4 p.m. We were super excited to go home. Lo and behold, we tried to turn on the car and it won't turn on because someone left the lights on all day. So now we went up to the security guard, and he's super nice. He's 21 years old, just so nice. And he's going to start our car using his very expensive Mercedes. We hope it doesn't get ruined. So yeah, we're just sitting outside the hospital and just waiting for the security guard. Yeah. Anyway, that was just on the first day. We were all nervous and clearly we forgot the lights. But the rest of the time was fine. My friend's car was fine. And it was lovely to be able to carpool together and debrief after a long shift. Anyway, my week in gynecology involved mostly outpatient clinics in which I got to help see patients with a wide variety of gynecological queries, including that of contraception, fertility, possible pelvic infections, and endometriosis. For my week in obstetrics, my time was divided between outpatient clinics, on the ward, deliveries, and in the operating room for C-sections. So it was quite varied. Now for the outpatient clinics, it was mostly for pregnancy checkups, which was really cool to see because I would get to see women in the very beginning of the pregnancy and also into late pregnancy, and a variety of things that the doctors need to check on, such as signs of diabetes, hypertension, and overall fetal health. I did learn how to use Doppler to check for a baby's heart rate. So this was really, really cool because it's a very basic skill, but it's so important in checking the baby's health. And it was just really rewarding to hear that baby's heart rate, especially for the mother. Now, I did also get to spend time on the wards helping out with deliveries and labor. And oh my gosh, yeah, labor is hard. Like it is, I had no idea how long, how difficult, how painful labor can be. And I have mad respect for women, all women out there that have gone through this. And yeah, I totally understand why a lot of women opt in for epidurals because yeah, it is a very painful thing. And, you know, some women have a wonderful experience, but there are a lot of complications that can come up. And so it's good to be sensitive and empathetic throughout that process. Some of the things that I also got to see were elective and emergency C-sections. And so this is when you go to the operating theater to deliver a baby through the abdomen. And I did get to scrub in for some of those C-sections. And I will say the first one that I assisted on, I almost fainted. Just because it's one thing to view it from afar and it's another thing to be right there with your hands on the abdomen and just see all this blood coming out, and it was pretty confronting. And I also didn't eat because it was during a night shift, and so yeah, I highly recommend you taking those extra 2 minutes to drink and have a quick banana or something before you go assist, especially if it's your first one. The following 2 weeks, I returned to the main teaching hospital and I completed another week in obstetrics and 1 week in fertility. During the obstetrics week, I completed 2 night shifts, and yeah, that was really exhilarating, but also it's just so exhausting. And I got to meet some wonderful midwives, and I realized, midwives just run the show. Like, a lot of respect for them. During the latter week, I got to sit in to the early pregnancy clinic and ultrasound scans. Now, this week was pretty confronting. In some of those clinic sessions, it was when the doctor would have to explain to the mother that, yes, this was a complete miscarriage and that the mother lost her baby. And obviously this was extremely heartbreaking, but it was also a really memorable learning opportunity for me, just because I got to see how the doctor communicated these results to the patient in a kind and empathetic way. Lastly, in my 8th and last week, this was dedicated to my written exam and my Osce. Now, for those of you that may not know, the Osce is an in-person clinical skills exam. So you are given 2 minutes to read a random scenario, which is written outside the door, and it can be anything. For example, a typical Osce would say, this is patient X, patient presents with XXX, please take a full history, or please take a full examination. And then you have to explain your findings to your examiner, and also explain to your examiner why you came up with these differential diagnoses, why you would treat them with X. And so yeah, it's like being a doctor, but with actual doctors judging how you take on these cases. So it's pretty nerve-wracking, but I think it's pretty essential to practice these clinical skills. So yeah, I completed my Osce exam and the written exam, so I was very happy to have that done. It did require a lot of studying. I spent quite a bit of time in the library and studying at home in my last 4 weeks. So that was tough, having to complete long shifts in the hospital and then coming home tired, but still having to study. So yeah, I definitely relied on a lot of resources, including my school resources, but also external resources. And there's some resources in particular that really helped me. The top 3 resources, external resources that I relied on was 1, reading the Gynecology and Obstetrics chapters in Toronto Notes. 2, watching boards and wards OBGYN videos on online med ed. And 3, rewatching some osmosis videos on physiology topics that I couldn't quite remember. So I hope those resources help you out if you're doing a future rotation in OBGYN. And I highly recommend this rotation if you can select for it in your medical school, as it's super, super rewarding. And it's so wonderful being able to serve women and their babies. That's it for me. See you guys later. Bye.